Well, our main interest is in quality. We always try and make sure that quality is at the heart of what we do at Nuffield Health. We are passionate about the quality and safety and outcomes of what we do because we think there's a real gap in trying to give information to the public so that they have the information to help them to choose healthcare. As an organisation, we are very keen on being open and transparent because that drives behaviours and cultures which we know lead to higher quality provision, and make sure that everybody's engaged in our organisation, right from the board through to the ward, providing care to patients and consumers. I guess the crux of the argument comes down, is there really enough quality information across the healthcare system to allow the public to increasingly choose who provides their healthcare?
So what are the challenges in creating that kind of quality information?
Well, as a doctor, I think there's a lot that my profession needs to answer for. Modern medicine's been out there for many thousands of years, but yet there is no universal or approved system for defining quality of care across the health system. I know at this conference we've been hearing about advances in health measures in the US with the cardiac measures. We've tried the same in the UK, and they've been very successful in that area. It's often focused on mortality. But the quality of healthcare is a lot more. It's about the scope of services that we provide. It's about the waiting and the access to the services, and then there's all the quality measures around that service, which might be anything from customer satisfaction and complaints through to clinical variances. It might be something to do with incidents. But we also think that there's a lot to be said around outcomes, around what is the benefit of having a procedure with us or engaging in one of our wellbeing programs. So really my pitch to the conference today is to say, well, I think we could do with some quality measures that span right across the health system that will benefit public and private providers like ourselves, because it will give information. Reputations will increasingly drive healthcare. We believe the health consumer is increasingly interested in this area, and it will allow governmental programs to try and drive performance, as we've also been hearing earlier today.